Hello, Deerfield residents. This is Justin, your Director of Lifestyle, coming to you on National Fall Prevention Awareness Day. And I just wanted to talk to you about a few things that some of you may or may not think of when it comes to being aware of what could potentially cause a fall. We have a misconception that oftentimes it's just our balance. Our balance is off, we don't feel great, and that can lead to a fall. But there's many things that have shown through many science and years of research that can affect falls and the prevention of falls. So one thing I wanted to discuss, one thing we don't often think of that does affect our balance and could cause a fall is our medications, the medications we're on. Now, I want you to be very understanding that I am in no way a doctor, and I am not suggesting in any shape or form that you discontinue a medication. What I'm simply doing is providing a little bit of education for you to discuss with your doctor or potentially your pharmacist, maybe some concerns you may have regarding a medication. So some medications that have been shown to cause falls are those that we kind of take with maybe some pain. So an opioid or a narcotic type pain medication. So, you know, your oxycodone, your roxicodone, the hydrocodones or the Lortab or the Vicodin. Those things, those types of medications can cause dizziness, sleepiness, drowsiness. And so if you do take those, be aware of how that makes you feel and discuss that with your doctor when receiving those. Some other medications that are fairly common that can cause side effects or changes are antidepressant or mood type of medication. So your Prozac, your Zoloft, your Alapvil, those are, you know, your name brand. But, you know, if you have a generic form of those can also change some of the feelings we may have. So anti-anxiety medications as well. So your Valium or your Xanax. And even your prescription in over-the-counter sleep aids, you know, Ambien, Benadryl. Those can also make us dizzy or drowsy, which can lead to a fall. So you need to be aware of those. Some other medications that are important to understand and know are some pretty common medications that again can affect how our body reacts and how our body feels. Our high blood pressure medications are heart medicines. So the Tropol, Lipressor, Norvazac, Lasix. Those heart medications and those high blood pressure medications can change our physiological, which is what it's intended to do. But again, we need to be aware of how it feels in our body. So if it does lead to dizziness or drowsiness, or you just don't feel comfortable, again, have that conversation with your prescribing physician. Also, you know, muscle relaxing medications. So your Tramadol, your Soma, your Flexeril. You know, when we're in pain, it's not always easy to make it through the day without some of these medications. But we also need to be aware of how these medications make us feel. In any antipsychosis or mood stabilizing medicine, your Risperdal, your Sercoil, those are all medications that are fairly common and can contribute to falls. And if you're still driving, can lead to automobile accidents. So again, from a safety standpoint, we need to be aware of those. We need to be cognizant of those and having that open dialogue with your prescribing physician. So things that you want to just be aware of and side effects you want to look out for. Again, that can lead to that conversation with your prescribing physician. So changes in vision, changes in awareness, slower reaction time, a feeling of sluggishness, muscle coordination, tiredness, the hypotension, so the dizziness when you come to a standing every time you come to stand. Those are all side effects that we want to be aware of and can lead in contributing factors to falls. So again, I am in no way, shape, or form a physician, but these are things that you do want to be aware of and pay attention to, and making sure you're having that open dialogue and that open conversation with your physician. If you have any questions or if you need help with medications, we do have home health here within Deerfield. And if you need some help with that, please contact our front desk and we can put you in contact with Kim Mason, our Director of Nursing, as well as Zippy, who is another home health registered nurse. And we'd be happy to point you in the right direction if you do have concerns or questions. Always, again, being aware of how we feel at all times, being aware of that will make a difference. And with that, we can make sure that we take those chances in reducing falls. So thank you for joining me. We got a little bit more information coming your way. So again, stay tuned. Hello, Deerfield residents. This is Justin Riesberg, the Director of Lifestyle. I'm here with Beth Zigman, our fitness instructor here at Deerfield. We want to talk to you about some balance exercises and things you can do to improve your balance from a strengthening and balance exercise, things you can do at home safely in your own room. So first, Beth is going to show us a very easy and common exercise for us to do, which is a sit to stand. And Beth, how many repetitions do you think you should do of this?
Usually you want to do at least 10 to 12, 2 to 3 times a day, and you can do it every day of the week.
All right, perfect. So I'll get out of the way. I'll let Beth demonstrate a good movement when it comes to a sit and stand. Now also, Beth, what is the best chair to use for?
Well, kind of like this. You want something that's firm and make sure it's not going to slide on your floor. And just make sure, like, you might need you can have arm handles if you need it at whatever you have at home, usually like your kitchen table.
Yep, perfect. All right, Beth, go ahead and demonstrate for us.
All right, so stand with your feet a little wider than shoulder width apart, and just make sure you're relatively close to your chair, and then just try to sit, touch that chair, and then come back up, and just keep going. So try to go, if you sit actually to the chair, that's fine, as long as you're doing the motion. So
that's great. Awesome, Beth. So what are some other good exercises someone could do at home next to a counter?
Well, you can do some calf raises. So just kind of go up and down on your toes. And you can hold on, or you don't have to hold on. And if you want to, you can kind of shut your eyes when you do that too. Anytime you shut your eyes, it just makes it a little, checks your balance a little more. And then you can actually go round back over on your heels. So you can go up on your toes and then kind of lean back. So that's another variation.
Very good. Anything that works to build some strength maybe in our hips, because also obviously hips are very important when it comes to strength and balance.
Yes, you can still stand where you were and just do some leg raises. do a couple, like about 10 to 12. That's a good, just remember 10 to 12 on everything. Lift to the front, and then lift out to the side. So make sure your foot stays straight ahead. And then you can also go to the back. So just make sure the leg you're standing on just stays slightly bent so that you don't get a lot of pressure on your knee while you're doing this. So you're working all the areas of your top of your leg around all the way to the back. So you get the front and the back and the side. So all the whole hip. And then you switch and do the other leg.
Perfect. Those are all excellent exercises when it comes to strength. Do we have some good balance exercises that people could do at home?
Well, the basic easy one is just stand on one foot. And you can hold on if you need to, but try to go up to 30 seconds. And you can do it with your eyes closed also. And if you want to make it harder, just kind of look different directions. Just try to challenge and make your balance a little, each way is a little harder. And then you can also kind of walk the line. So try to find just like a straight line to walk on. So walk forward and walk backwards. Make sure you keep your head up. So don't look down. Try to stay straight ahead. And then you can also kind of tip forward and tip backward on that same line. And make sure you switch and do each leg. So make sure each foot gets even work each direction. So just make sure you're close to something to hold on to just in case. But obviously, the more you challenge yourself, the better you'll get. So just keep working on stuff. And then you can also go side to side and tip side to side too, because you're not always going to fall forward. You might tip sideways. So this is a good one to do also.
Excellent. And Beth, do you think when it comes to balance exercises, do you think it's a good idea for people to do them every day, every other day when it comes to balance? Obviously, strengthening exercises we want to do every day. But what about balance exercises?
I think you could do them every day also. Just make sure you're not tired. Like I would do them more in the morning, or when you feel good, just so you're not like, don't be drinking, don't just take medication or anything like that. Just make sure you're, good and you have good balance at the time. And make sure you have either comfortable shoes on or nice flat soles, so it will help a little easier too. Or barefoot is fine also.
Perfect. All right, Beth. Well, I appreciate your time. I hope this is something that people can use at home. If they have any questions, obviously they can reach out to you down here in the fitness center. If they have questions, you can also find myself as well. And if I can't answer it, I'm sure Beth can, or vice versa. So we appreciate it. We hope everyone has a very fun and enjoyable Fall Prevention Awareness Day. Thank you again for joining us. Hey Deerfield residents, Justin here, wanting to discuss another issue that can be related to falls, and one that is fairly common in the older population is the use of an assistive device. Now, assistive devices are fantastic to help us in need if we do have a sense of balance problems and a need to help us with those. So the thing, though, we want to be aware of, though, is are we properly fitted and are we using them correctly? My recommendation is visiting either a outside physical therapist to discuss that with them if you have one that you've used previously, or if you need to, we can always set up a time to meet with our rehab care team. I was hoping that they would be here to assist me today, but unfortunately there were some conflicts that wouldn't allow for them to be here today. So I'm here. I am not a physical therapist, but I have worked in physical therapy clinics before, and I've discussed this with many people throughout my career. The first one I wanted to discuss is what we call a four-wheeled walker. one that's most common in Deerfield and in and around those that are maybe 65 and older that have balance concerns. Okay, so again, the four-wheeled walker, why it is called that is simply because it has four wheels. Okay, within a four-wheeled walker, the important thing is we want to make sure that this four-wheeled walker stays within our path. So what I mean by that is, as we're walking, we should be able to remain upright, a slight bend in our elbow. Okay? We also want to make sure that we're walking in between, as close to those wheels as we can. Okay? So when we're walking with this, a common deviation from our normal, what should be a normal walking pattern within a four-wheeled walker, is it tends to start to get away from us, which then makes us start to lean forward a little bit more. So we start to push it out here. Well, it's not a shopping cart, okay? It is a walker, and it's an assistive device to help us with our balance, okay? So we want to use it correctly. We want to make sure we're using it here, keeping it fairly close to our body. And also, we don't want to be leaning on it, okay? The more we lean on it, the more it's going to cause adverse reactions within our upper body as well, okay? So those are things that you want to be aware of. Now, they typically come with a seat here. Now, while I don't recommend really ever sitting in them, I know it's fairly common to do so. But one issue is making sure that our brakes are locked, okay? And as we do that, we also want to make sure we're turned completely around before we ever do make our descent into a seated position on our four-wheeled walker. So those are kind of some of the most common deviations that you'll get from a four-wheeled walker. Again, we don't want to keep it out here, right? We want to keep it close to our body. We want to make sure that we're staying as upright as possible, and we're not having that forward lean. Okay? Because once we do that and we forward lean, the farther and farther it gets away from us, the more, okay, the chance of it rolling away completely from our body. So if you have questions on the use of a four-wheeled walker, certainly ask myself, Beth Zigman, our fitness instructor, or we can also try and set you up with our rehab care team, and we can try and assist you in making sure that you feel as comfortable as possible while using this four-wheeled device or that assistive device. Okay, so I'm going to move on to another assistive device that can be used. Okay, this is called a two-wheeled walker. All right, a two-wheeled walker, obviously from the name, it has two wheels. Okay, this one oftentimes is one that people don't use as much because it's a little bit different. It requires really just a little bit more work, but it's more sturdy and it doesn't have as much of a tendency to get away from us. Okay, but the same concept as a four-wheeled walker is that we want to make sure that as we're doing this, okay, we have a slight bend in our elbows. We're staying within the rails of this walker, and we push it so we can stay as upright as possible. Because the same thing from a two-wheeled walker to a four-wheeled walker is the farther it gets away from our body, right, the more difficult it will be to recover if we have a loss of balance or a stumble, okay, which of course could lead to a fall. So we need to be aware of those things. So again, as we walk with our two-wheeled walker, stay within the guards, stay as upright as possible, making sure we're not adding too much pressure onto the handles. And also with a two-wheeled walker, as well as a four-wheeled walker, is we really don't want to be backing up. Okay? Backing up, especially if you do have a loss of balance, can lead to a fall. So those are some important and key things to remember when using as an assistive device. Another one, I don't have with me is a cane. If you're using a cane to walk, always be sure that you're setting it down and not leaning too much onto that cane. If you need a height adjustment on your walkers to make it more comfortable, to make it feel better for you so our posture is more upright and we feel more comfortable, again, please see myself, or you can also, again, see Beth. We can also have a maintenance. If they're around, they can adjust that for you, but certainly get some assistance with that so we can make sure that you feel as comfortable and as safe as possible, because ultimately that's the goal, right? We want to make sure that everyone here at Deerfield is safe. We want to have a fall-free rest of 2020, and so again, whatever assistance you need or questions you may have, please contact myself or Beth or our front desk at any time. Thank you so much for joining me, and we'll see you later.